So it says a young incarcerated male patient presented to the emergency department with shortness of breath, coughing. The patient has a positive PPD test. Chest X-ray reveals a middle lobe cavitation and hilar lymphadenopathy. What is the next best step to confirm the diagnosis? Alrighty, so I'm seeing some answers. If anyone else has a different answer, don't be shy, drop the answer. Giving you guys 10 more seconds, think about it. Alrighty, cool. So everyone says A, MAN2 test. So always remember, guys, read your questions very, very carefully. They can be tricky. So this question, it's a medicine question. It's testing the respiratory system, and it's a second order question, right? So let's go through it real quick. So, all right, ready. So let's read it. It says we have a young incarcerated male patient, right? I'm underlining the key things that we need to get an answer, right? So incarcerated, I'm underlining that. Says the patient has shortness of breath and coughing. Patient has a positive PPD test. And it says there's a chest X-ray that shows a middle lobe cavitation and hilar lymphadenopathy. So before we answer it, again, I mentioned it's a second order question, right? So let's take the first step, which is to diagnose the patient. So based on everything I just underlined, what do you guys think the diagnosis could be? So forget about, what you use to confirm, but tell me what the diagnosis could be. All right, perfect. So from you read this question, you have an idea that, okay, the diagnosis is tuberculosis, right? So you have that in mind, and now the question says, what is the next best step to confirm that tuberculosis? What can you do to confirm and tell me, yes, the patient has tuberculosis, right? So let's run through it. Option A says, do a MAN2 test. What's a MAN2 test, right? That's probably the first thing might be coming to your mind, or everybody else's mind. Or it's pretty straightforward. So let's run through it. The MAN2 test. So the MAN2 test, right? Another name for it is, and I'm putting it here because this is a very tricky question. The alternative name is PPD, right? So the MAN2 test is also the same thing as a PPD test, right? They use them interchangeably. PPD test means purified protein derivative test. Follow me? And now everything we're going to discuss here, I want you guys to commit it to memory, right? We haven't answered the question yet, but I'm doing teaching points, right? So everything here, commit it to memory. The first key point I want you guys to know, if a PPD test is positive, do not repeat it. Follow me? So the first thing is do not repeat it. So right off the bat, we know that A is wrong. Good attempt though, guys, but yes, A is wrong. I'm gonna continue. We're still talking about the MAN2 test. Things I want you to commit to memory is, remember the MAN2 test, they're basically giving you a little injection with some protein that has some of the antigens for the tuberculosis bacteria, right? Whether or not you react to it or not, via some form of hypersensitivity where you get a skin wheel at the point of the injection, it will tell you if you have tuberculosis or not. Follow me? So I have that down. So now we need to know some measurements because this is important. So if that particular skin wheel that you guys see is greater than or equal to 15 millimeters, right? If it gets big, greater than or equal to 15 millimeters in a normal patient, meaning the person isn't exposed to anything at all, then they are positive, meaning they have tuberculosis, right? Commit that to memory. If it's greater than or equal to 10 millimeters in a 1, healthcare worker, or 2, a prisoner, or 3, an immigrant from an endemic area, then they are positive. Follow me? Memorize these values, guys. Memorize that, okay, greater than or equal to 10 is healthcare worker, prisoner, immigrant. They have questions where they give you the particular occupation and they tell you the value of the enlargement, right? And you have to deduce whether it's positive or negative. Follow me? And then the last one is if it's greater than or equal to 5, right? 5 millimeters in a patient with close contact to active TB or an immunocompromised patient, right? If it's greater than or equal to 5 in any of those, then yes, they have TB as well. Follow me? Commit that to memory. That's very important. Make sure you jot it down, snap a picture. I'm clearing it. But make sure you guys remember this. But before I move on, can you guys tell me what you think this patient's PPD test might have been? Like, just give me the range. Pretty straightforward. Just give me the range, type it in the chat. Let me just make sure everybody's following.
Greater than or equal to 10 millimeters.
Yep. Exactly. Okay, good. So we'll have that down. So that's that. We'll have that down. We're all good. So let me clear that. Okay, good. So A is out. A is completely out. So now let's look at option B, interferon gamma assay, right?
Ronan, can you undo what you did so I can see what was there, please? I'm sorry.
Oh, sure. Let me, boy, it gone, you know? It gone. Sorry. You can WhatsApp me though, I'll send it back. That's fine. But let me move on. I can't undo it. It just disappeared. All right, ready. So interferon gamma assay, right? So this is a test that they usually conduct on a particular population of patients, and I'm going to explain the particular population. So in patients that did a BCG test, right? They tend to have a lot of false negative PPD results, right? So this is usually the population that they do an interferon gamma assay on, primarily. I'm going to explain what an interferon gamma assay is, and then we come back to that, right? So if you guys remember, we read that there's middle lobe cavitations and the patient had hilar lymphadenopathy, right? One of the key features of tuberculosis is granuloma formation, right? A granuloma formation is, and this is important, granuloma formation is essentially where the body can't properly destroy the tuberculosis bacteria. So to protect it and prevent the tuberculosis organism from spreading, you have a lot of macrophages that surround the pathogen, right? So that's what a granuloma is. Now, when macrophages surround the pathogen, macrophages have particular chemicals that they secrete. You don't need to stress your head and memorize these particular chemicals unless you are planning for the like USMLE or whatever the case is. But macrophages, always remember, macrophages can secrete something called TNF alpha, and they can secrete something called interferon gamma, right? So I'm explaining all of these tests because you guys need to know them. So this interferon gamma is what they're testing for when they do an interferon gamma assay. Follow me? So I'm going to explain this now. So say, for example, you have a patient and they have tuberculosis, right? They have it, but they're not showing any form of symptoms of tuberculosis, right? So they're asymptomatic. That's referred to as latent tuberculosis. Follow me? If you do a PPD test on latent tuberculosis, it can sometimes come back negative, right? So to confirm that, okay, you know, this person is actually negative, they do something called an interferon gamma assay, right? So the interferon gamma assay, all it's doing is just checking for interferon gamma, which is released by the macrophages. Everybody follow? Just type in the chat. I don't want to lose anybody on that. So interferon gamma is testing for latent tuberculosis, right? That's one of its functions. But also remember, interferon gamma can also be positive if there is active TB. Because as you guys can imagine, you know, like obviously if you have active TB and you have macrophages surrounding the pathogen, they're still going to produce interferon gamma. But it's just that the function of interferon gamma is just to check and rule out latent TB, right? But if we look here on the question stem, it said the patient have middle lobe cavitation, them have shortness of breath, them have cough up the place, all of that good stuff or bad stuff. They clearly have active TB. So there's no point in doing an interferon gamma assay, right? And before I leave this particular discussion, remember I mentioned here that BCG tests can give a false negative PPD test. I actually meant that was an error, right? I actually meant a BCG test can give a false positive. That's my bad. Let me rub that out. BCG test gives a false positive, right? A BCG test can give a false positive. So the function of an interferon gamma is to essentially confirm and check that, okay, are there macrophages there, right? Are macrophages surrounding pathogens or not? So in cases where someone did a BCG vaccine, if they have a false positive result, you can do an interferon gamma, right? So BCG vaccines, that would be like, you know, what every Jamaican did, really. When we're just born, I think everybody get that BCG vaccine. So it can't be A, it can't be B. Now we look at C. Remember, when you're confirming a diagnosis, all you want to do is just look and say, okay, yes, the disease is there. I'm looking at the bacteria, or I did a culture and the bacteria is there, right? If we look at sputum culture could possibly be an answer, but it's not specific. So if you guys are at the hospital or you're on the wards, or if you went by national chest, what you'll find is they always do an early morning sputum culture. And they do it for a couple of days, and then they send off the samples. If you do a sputum culture in the evening or in the nights or in the afternoon, there's a good chance that you won't get enough organisms in that sputum to culture it properly. So it's usually the early morning one. There's a reason for that. So when you're sleeping, all of the organism is just resting on the chest. It's not coming out. It's not like you're coughing in the nights to, you know, release the sputum and push out the bacteria. So you sleep and all of the bacteria just stuck up in the lungs. And then when you're coughing in the morning, get out the sputum, you have a lot of bacteria in that early morning cough with the sputum, as opposed to taking a sputum culture in the evening or afternoon. So option C, just saying sputum culture alone, that's wrong. More specific answer is to do a serial early morning sputum culture, and that's gold standard to confirm a diagnosis of tuberculosis. A MAN2 test, otherwise known as the PPD test, it's used for screening. Screening is different from confirming. Screening is just to see, okay, is it there? And then confirming it is to see if it's actually there. You get me? So the answer for question 3 is D, the serial early morning sputum culture, right? So good.